السلام عليكم ورحمة الله وبركاته. الجزء الثاني من محاضرة Pulmonary Function Test. كنا قد وصلنا للحديث عن lung volumes. حكينا أن residual volume وال functional residual capacity and total lung capacity cannot be measured by spirometry. وكان السبب أنه الspirometer can measure the expired and inspired air only. So the residual volume which will be remaining in the lungs cannot be measured. So we cannot measure the total lung capacity and functional residual capacity. So indication for lung volume test. Any patient if there is reduction in forced vital capacity زي ما حكينا في الجزء الأول, suspected restrictive lung disease, obstruction or obstructive lung disease pattern in the spirometry with hyperinflation and air trapping, mixed pattern and equivocal spirometry finding. يعني ال FEV1 وال forced vital capacity at the lower limits of normal. طبعا بصير measurement لللنج volumes بتو method. most common طبعا اللي هو في gas dilution test and body plethysmography or body box. زي ما احنا شايفين من الصورة الموضحة lung volume and capacity. طبعا احنا الفرق بين ال volumes and capacity. ال volumes is entity one entity. ال capacity أكتر من two volume or more combined together بنسميها capacity. في عنا هنا زي ما حكينا إن ال lung volume في residual volume, وهذا it's only measured by the advanced machine and cannot be measured by spirometer. Expiratory reserve volume. We have also vital capacity, functional residual capacity, inspiratory capacity, total lung capacity. زي ما احنا شايفين هنا tidal volume, inspiratory reserve volume, expiratory reserve volume, ورesidual volume. الtidal volume هو the amount of air inspired or expired by quiet resting breathing. يعني أي patient بتنفس resting state بيكون يعني بياخد اللي هو breathing اللي هو tidal volume. Inspiratory reserve volume, the amount of air that can be deeply inspired after normal inspiration. Expiratory reserve volume, the amount of air that can be forcibly expired after normal expiration. A residual volume, the amount of air that remains in the lung after maximum expiration. Vital capacity, maximum amount of air that can be expired after deep inspiration. So الvital capacity ايش بتساوي؟ tidal volume, inspiratory reserve volume plus expiratory reserve volume. في عنا طبعا الفيتال كاباسيتي في slow vital capacity وفي forced vital capacity. الفورست فايتال كاباسيتي اللي هي احنا بنخليها البيشنت يعني المانوفر يعملها during spirometry test. طبعا للمعلومة يعني spirometry only is available in Gaza hospital. في واحد يعني موجود في مستشفى ناصر وفي في الشفاء مستشفى مستشفى الشفاء. We requested the lung volume machine dilution test وإن شاء الله يعني يصل قريبا على أساس for further management and testing the patient. Slow vital capacity, maximum amount of air that can be expired after deep inspiration by slow expiration وفي fast. Functional residual capacity. طبعا it is the volume of air remaining in the lung after resting normal expiration. Functional residual capacity بتساوي expiratory reserve volume plus residual volume. Total lung capacity, it is the volume of air remaining in the lung after deep inspiration. بالتالي total lung capacity تساوي tidal volume plus inspiratory reserve volume plus expiratory reserve volume plus residual volume. واحنا زي ما احنا عارفين tidal volume والinspiratory reserve volume والexpiratory reserve volume بيساوي vital capacity. So vital capacity plus residual volume هيعطينا total lung capacity. طبعا في obstructive lung disease and restrictive lung disease and normal, usually there is a relation between vital capacity and residual volume and total lung capacity. الريزيدوال فوليوم في الإنسان normal residual volume divided by total lung capacity لازم تقريبا يساوي 20 إلى 35%. In obstructive lung disease إذا كان residual volume in relation to total lung capacity أكثر من 35%. It is increase in residual volume. And if there is less than 20%, it will be in restrictive lung disease. Total lung capacity increase with obstructive lung disease and air trapping or hyperinflation, and will be decrease in restrictive lung disease. تمام? How we can obtain, as we mentioned, in body box test or nitrogen washout or helium dilution test. طبعا هنا اللي هو Boyle's law اللي هو يعني equation for body plethysmography. طبعا المريض بيكون داخل الجهاز معروف الأحجام وthrough specific equation in particular volume معروف اللي هو functional residual capacity, and can be also giving us the measurement, accurate measurement of residual volume and all the other volume اللي بتهمنا total lung capacity residual volume. Nitrogen washout also the circuit can open the circuit method of patient breathing 100% while the nitrogen washout of the lung is measured. والhelium dilution برضو the same way. هلا بهمنا هنا في الموضوع ان نعمل normal value of the normal pulmonary function test. الفيب 1 من 80 ل 120%، من 80 ل 120%. force vital capacity من 80 ل 120% it is normal. الريشيو أكثر من 80 أو أكثر من 70%. total lung capacity من 80 ل 120%. functional residual capacity 75 ل 120%. والريزيدوال فوليوم 75 ل 120%. وزي ما حكينا الريليشن ريزيدوال فوليوم تو توتال لانج كاباسيتي من 20 ل 35%. لو أكثر من ذلك بيصير obstructive، ولو أقل من ذلك بيكون restrictive. وفي الديليوشن كاباسيتي أكثر من 60 أو الديفيوجن كاباسيتي TLCO أكثر من 60% وأقل من 120%. can be considered as normal. هاي البادي بوكس اللي موجود في مستشفى حمل. And multiple equation can be البيشنت بيكون قاعد inside the box and breathe through the mouthpiece connected to the shutter of internal volume of the box. هنا لازم معلومة مهمة بالنسبة لل total lung capacity if it is more than normal. total lung capacity if it is more than normal يعني أكثر من 120% بيكون there is sign or hyperinflation in the pulmonary function test, while in residual volume بيكون if it is more than normal there is air trapping. Air trapping or residual volume increase, this is mean asthma, and in TLCO, total lung capacity, if it is increased, this is mean hyperinflation, and this is emphysematous changes. طبعا الاكزامبلز زي ما احنا شايفين هنا. This is a pulmonary function test of the patient. If we look at the flow volume loop, as we see here, dog leg appearance. So there is suggestive of severe obstruction in case of the emphysematous changes or COPD. نيجي على spirometry measurement. spirometry الفيب 1 34% severely reduced. الفورس vital capacity 67%. الريشيو 36%. الريشيو 36. نيجي على lung volumes. as we see total lung capacity 174% and residual volume 364%. and post bronchodilator measurement FEV 1 didn't improve actually, so the flow volume loop suggestive of obstructive defect with feature of dog-leg appearance characteristic of emphysema, severe irreversible obstructive defect with air trapping and hyperinflation. Diagnosis is asthma. Gas transfer TLCO or TLCO measure the ability of the lung to transfer gas from the environment to the bloodstream. طبعا في أشياء بترفع ال TLCO وفي أشياء بتقللها. TLCO or TLCO reduced in specifically in lung fibrosis in COPD because the blood alveolar-capillary membrane there is impairment either by fibrosis thickening or in COPD there is destruction of alveolar-capillary membrane, so the TLCO will be reduced. TLCO can also increase in patient with asthma, in patient with alveolar hemorrhage or pulmonary hemorrhage and other disease. Sometimes very important sign, patient with pulmonary hypertension, spirometry can be normal, lung volume can be normal, isolated reduction in diffusion capacity in a patient with dyspnea. The diagnosis is pulmonary hypertension until proven otherwise. طبعا زي ما احنا عارفين النورمال اوف تي ال سي او، قلنا احنا من 60 ل 120 او من 81 ل 140 it is considered normal. Disease that can allow the blood to pass through the poorly ventilated area of the lung زي ما قلنا obstructive lung disease, emphysema, cystic fibrosis, interstitial lung disease بيعمل reduction، والكارديوفاسكولار زي pulmonary edema, heart embolism, pulmonary thromboembolism والpulmonary hypertension كلياتها بتعمل decrease in the TLCO. وزي ما حكينا إن TLCO increase in pulmonary hemorrhage, sometimes in pregnancy, in asthma and pulmonary resection لأنه بيكون علاقة بالبوليو والأنيميا. polycythemia, pulmonary hemorrhage, exercise asthma and mild obesity. Isolated reduction in DLCO is considered about pulmonary hypertension, sometimes early or mild interstitial lung disease or DBLD or emphysematous changes. نيجي على example. This patient is a 46-year-old male patient. لما نيجي نشوف السبيرومتريك تيست، الفورس فيتال كاباسيتي 71% والفيب 1 61%، الريشيو 64%. If we look at the flow volume loop, as we see here, there is concavity or scalloping of the expiratory loop. This is inspiration and scalloping of the expiratory loop. So there is obstructive lung disease. برضو احنا في there is a little improvement. There is improvement after bronchodilator. It's significant improvement, about 32% improvement in FIB1 post bronchodilator. So by looking to the flow volume loop, there is obstructive lung disease with significant improvement. This is indicated the bronchial asthma. Force vital capacity 71%، الفيب 1 61% والريشيو 64%. There is improvement 32% post bronchodilator. نيجي نتفرج على ايش؟ lung volumes. Total lung capacity 90% and residual volume 142%. So here as we see total lung capacity normal لكن residual volume more than normal, so there is air trapping. So there is air trapping and the TLCO 85% will adjust it to the alveolar volume 110. So this is a case of asthma. Mild obstructive pattern with good reversibility, air trapping, increased residual volume, normal diffusion capacity, diagnosis bronchial asthma. Another test. This is a patient with functional force vital capacity 42%، الفيب 1 57%، وبالتالي there is severe reduction in forced vital capacity, ratio 95%. By looking to the flow volume loop تقريبا نفس الطبيعي بس يعني smaller in size and the volume the inspiratory loop or expiratory loop and but it's smaller in size and restrictive pattern in spirometry with post bronchodilator تقريبا 1% improvement. TLCO 48%. total lung capacity total lung capacity not TLCO and residual volume 53%, also severely impaired diffusion capacity 63. بالتالي this is a moderate restrictive defect, decreased lung volume and residual volume, reduced diffusion capacity, severe intrinsic أو interstitial lung disease. طبعا هذا مثال برضو how to measure the diffusion capacity and total lung capacity, lung volumes, spirometry. Challenging test. This test can be used in patient if is complaining of dyspnea and with بنعمل له spirometric measurement بنلاقي عنده انه normal spirometry لكن we still having a highly suspicion that this patient is having obstructive lung disease, bronchial asthma, so we challenged him with methacholine اللي هو بيعمل release للhistamine and can cause a bronchoconstriction. We show several doses until to reach to the P20. If it is significant, can be also diagnosed as bronchial asthma, which is a very important test. So by this I will end my talk. We spoke about spirometric measurement, lung volumes, diffusion capacity, and bronchial airway challenge or challenge test. The four important tests, which is very important in any pulmonary function test lab for measurement and assessment of our patient. Thank you.